you put the slides, make it small, the slides, Kareem.
Make it small?
No, you just like it, it's quite, you enlarge the screen.
We can't see your full screen, so they are very big.
I see, but how could I do this? I don't know.
I think you should stop sharing, switch off your
Okay, okay.
PowerPoint and then reshare.
Okay, how this is escape. How is it now?
Just a little bit. Yeah,
It's
this is
okay,
good,
but they are moving very
make it
fast.
smaller. Yeah, it's okay, but make
is
it
okay now.
smaller. Okay.
This is a regular size. Then when I make it big, like it will be like this.
Okay.
It is not shown?
Okay,
should
you
go.
can go back from the first slide and can start.
Yeah.
Yes, Dr. Ali, you can start with the intro.
Okay. Bismillah ar-Rahman ar-Rahim. Good evening, ladies and gentlemen. Welcome to today's Saudi Society of Medical Education's webinar. We will delve with the transformative informations about competency-based medical educations and the educational methods associated and strategy associated with that as we explore this exciting topic. We reflect on the society mission to advance improvement in the evidence-based practice in medical education, teaching, and learning, and sharing these informations give up great opportunities to improve educations, enhance decision making, and prepare future healthcare professionals for ever evolving landscape. This aligned with our aim to foster progressive methodology that alleviate the standard of medical educations across Saudi Arabia and the communities and beyond. Without further ado, it's today's webinars is going to be exploring workplace opportunities in medical education. All of us know the importance of the workplace opportunities, especially in the under and postgraduate medical educations. And the best person to talk about this is Dr. Karimuddin Ali Saleh. He is Associated Professor of Pediatrics and the Consultant of Medical Educations at the University of Bisha, which is in the southern part of Saudi Arabia. He is harboring of the Master of Professional Education of Maastricht universities, and he has an interest in the educational strategies and methodology, including problem-based, theme-based, and continue educations. Dr. Karimuddin is very active in the field of the medical educations. He published more than 25 publications related to variable subject in medical educations. Without further ado, I would have the honor to invite Dr. Karimuddin to start his talk. Thank you very much. Dr. Karim, the
Hello
mic
there.
is yours. Yeah, the mic
Thank
is
you
yours.
very much. Bismillah ar-Rahman ar-Rahim. Thank you very much, Dr. Ali, for your kind word. And I hope to fulfill the objective of this presentation and to make, a forward movement towards improving our medical education strategies. And our main objective in this session. And before that, actually, I want to express my pleasure, gratitude to our esteemed member of Sesame, the Saudi Society Medical Education member, and other colleague. I sincerely thank all of you for your valuable time in participating in this workplace-based education session. I'm sure your presence and contribution in making an initiative would be meaningful and impactful, and your dedication, in fact, to advancing medical education through workplace learning will reflect your strong commitment and strong, movement and accountability toward improving the care of the patient in the future. So your insight, experience will enrich our session and our talk today. In fact, the undergraduate journey is challenging and is so demanding, where student he need, or the learner, he need to pass through a lot of skill like thinking, reasoning, communication, professionalism. So during the undergraduate period, it might be too long to finish this thing. So in workplace, the opportunity is there to reflect all these things in short time. So it is our commitment, all of us, to enhance this. Therefore, our main learning objective here is to explore the opportunity for workplace education and to describe the principle and value of workplace learning or education. Sometimes I use the word work-based learning, and sometimes directly I speak of workplace learning and assessment. Moreover, we want to discuss advantage and if there is possible disadvantage so that to overcome it and to look for method and process to overcome it. In fact, I want to, acknowledge the help of the president and chairman of our medical association, Dr. Hassan Al-Zahrani, and also to send and to extend my appreciation to Dr. Ali Rahimi and to Dr. Shazia Iqbal for maintaining the heritage of education through this session, which ran for a long time. And I am one of the people who gain my knowledge from the experience and reflection which we have attended here. So I think it is very great job, Dr. Shazia and Dr. Ali, for this process, and I hope to continue this thing. My presentation will be into 3 parts. The first part will be just an overview, might take 23-24 minutes. Then I will give some reflection on workplace-based learning for 10-12 minutes. At the same time, will be allotted for workplace assessment. I am intending to leave ample of time for discussion. I will leave 15-16 minutes for discussion. So part 1, we are going to have just precise overview. An overview to start about the historical background. In fact, workplace start early in the history of medicine, and it is concise with the inception of medicine itself. And before Abraham Felixstowe report, people, they adopt the apprenticeship education, where a junior student, they join with a senior student to learn from them. However, without any accountability. The chief and the senior staff, they are accountable only to themselves. When Abraham Felixstowe came, as he was mandated by Carnegie Foundation, 1910, he called for a standard in medicine. Might be it is the first time in North America.
المفروض يمكن اذا جاء ولدك وشاف الشركات هنا يمكن كان وقع معهم بعض العقود.
Hello?
Sorry, somebody is keeping their mic on. Can you please mute yourself?
So Abraham, he adopted a rigorous criteria for admission to medical colleges. He looked for evidence-based medicine at that time, and he gave the workplace large space at that time. Yes, nowadays we look at Abraham's experience, he was against integration. He made the basic science separated from the clinical science. But at that time, it was considered as advancement and progress. At least, he gave much interest and much space for workplace by giving 2 to 3 years for clinical study. After Abraham, a lot of development emerged in medicine, like that developed by McMaster University, the problem-based learning, which exists up to this time. Then, and at that time, some people, they look at the BBL as a fashion, but in fact, it is not a fashion. It is a concept. And then integration. And recently, now people interested in many concepts, like entrustable professional activities and like, health system services or health system science, where they call for the delivery. Before, people interested in basic science and clinical science. Now the third pillar is the HSS, the health system science, which call for health delivery and building leadership. Then, the workplace-based learning. And recently, whether you agree or not agree, whether we like it or you don't like it, it is a time of AI. And at least in this program, how many sessions has been performed and conducted for AI? Why? Because it's important. We can't escape of it. We need to, to make it a part or to make it a part of our curriculum. So this is just a background about the development. And now there is a lot of trend in learning. And the most important one is lifelong learning. All effort by curriculum designer, by administrator, by tutor to make their student adopting the culture of life learning and to disseminate it and updating. For instance, during the Corona, a lot of people, they don't know what happened for Corona because it was not there in our curriculum. But if you go to the workplace, you will get a patient with Corona. You will start to learn to update yourself. So this you will get it in workplace and changing experience with others, as we have in this place now, in this platform where we change experience. And interaction with other stakeholder, development and maintenance of self-responsibility, and the self-directed learning. When we, adopt the workplace learning, the trend is the student to learn himself, the student to look for his objective, to look how he could fill a gap in his knowledge, and also by directed self-learning. How they develop directed self-learning? From their tutor, from their mentor, because feedback is a backbone of workplace learning. And at that place, people will develop their distant self-directed learning as well as entrustable professional activity. Here, the student will be trained to conduct some activity. Then he will be a real stakeholder. He can manage patient, and this management might be very simple, like management measurement of blood pressure up to intubation. And the interprofessional education, another trend now adopted because nurses, as an aligned part in the system, and other stakeholder might share the same interest. So interprofessional education is highly needed. And learning by doing. Certificate is very important to gain certificate. But also learning by doing is appreciated. If you have a good experience and it is based on good data, that is recommended. And in workplace, student or learner, in fact, might learn by learning. I prefer the word learner, because learner might be student, might be postgraduate. But in fact, already postgraduate students, they receive their work in the workplace. And here we are going to enhance and core for application of workplace learning in the undergraduate programs. The definition, there were a lot of definition by different authority, and all of them, they share the same principle. It is just receiving your education on the job. And on the job, it means that this definition, when it is first started or arised, because it developed from workplace, from worker, from company. A lot of things we learn from company. So The workplace has a lot of definition, but simply it means to receive your education in your workplace by interacting with the staff in a structured manner, not in a haphazard manner, in a structured manner. In fact, you need to support and to provide evidence for workplace education. And the most important evidence is the educational theory. Whether the educational theory support this or not. If they support it, that means it should be mandatory for every educator. From behaviorist perspective, workplace will change the behavior of the student by attaching to the patient through stimulus from the patient themselves, or from the stimulus from their tutor, or from the stimulus of the workplace. Through these stimuli, they will change their behavior. And from the cognitive point of view, workplace will allow the thinking process in the brain to go smoothly because they concentrate on the workplace and any other distractor will be out of concern. And from constructivist point of view and perspective, as they told us in this theory, they told us that previous experience will help people to develop future experience. And from humanist point of view or perspective in workplace, the learner is trying his best to actualize himself by self-directed learning. And finally, from social cognitive theory point of view, in workplace, you will get different people. Some of them are senior, some of them are junior, some of them are nurse, lab technician, radiologist. You will gain experience from all these part of the team. So by considering this theory, you will get that this theory will enable us to conduct the fair learning model. What is the fair learning model? The word F refers to the feedback. Without a proper structured, immediate, prompt feedback, workplace is nothing. So feedback is very essential. It is a backbone of the workplace education. And the word A, active participation. The tutor, he should make sure everybody from the learner is participating and to concentrate on individualities because, some learners are very shy, some are active and shouty. You need to manage this. And finally, relevance to the student. The work should be relevant. If they are in the first class, you should have to concentrate in basic things. If in the final class, you should have to concentrate and to be relevant to more advanced application in the workplace. Who are the stakeholder and what are the premises for workplace-based education? In fact, sometimes if you ask any person or any colleague, do you receive your process of learning and teaching, and coaching and facilitation at hospital or at class? Some of them, they just get the simple answer. They might tell you, we don't have university hospital. I don't think this is a prosperous answer. And the best answer is that we have a lot of premises around us. For example, here in Kingdom of Saudi Arabia, if you look at any town or city, you will get a lot of health premises, a lot of primary health care center. Enough. This center can provide good learning, provided that we have adequate and relevant and excellent curriculum. And of course, you will get district hospital, tertiary hospital, and some center for rehabilitation. But in fact, really, I want to stress on the primary health care, which are scattered everywhere and then where you can practice our process. Then the most important partner to me and to you, I'm sure, is the patient. Because the patient is the best textbook. The patient is the best tutor. And then the staff in the hospital. And this point is very delicate, those who are working in the hospital. Because a postgraduate student who graduated today and received his PhD or MD, he will not be a competent facilitator on the very nearest day. So he should have to receive some education and workshop to allow him how to facilitate. And the same thing applicable for technician, for administrator, for nurses. It is the duty of the institute to train them, to provide them with the basic knowledge in teaching and facilitation. In fact, there are a lot of rationale for workplace learning. First of all, movement from showing how to does. Of course, this refers to Miller pyramids, where, many of the school, when they perform OSCE as a skill lab, they did a great job for sure. But what after OSCE? What after show how? Is does, how he will do the thing. This will be at the hospital. So workplace will allow this movement. And integration of learning and assessment. I have seen some accreditors during accreditation, they ask, how do you integrate your assessment and your learning? I think the answer will be justified if we are doing workplace learning. Also, one of the rationale is to provide prompt and immediate and instant feedback, enhancement of professional education, as I mentioned, to share knowledge with sisters, with nurses, with all the staff there, the team. And now, as Dr. Ali, in his introduction, he insists and he repeats the word competency-based training many times. And we know what is competency and what is the meaning of interacting many competencies to allow somebody to perform his task. This will be provided and achieved in the workplace. And also, it is authentic type of learning. Imagine teaching of basic life support in the emergency room. Compare it with teaching of life support as the skill lab or the classroom. And of course, you can see in the workplace how integration of a health process to the patient. And as I mentioned, collaboration and the need for learn and trainee to acquire other health system management. It is movement by adopting and adapting workplace learning. It will allow student or learner, in fact, to move from vision to mission gradually. What I mean by this, all medical students and all of us, we could remember our days when we enter the school. We dream of helping people. We dream of how could we perform blood pressure measurement and other things, up to the moment where you can, finish your undergraduate and you become a qualified doctor. But in a workplace, the student, he can move very quickly from his dream to mission in the workplace learning. He can do a lot of things. He can do vital sign, inserting nasogastric tube, inserting into a lot of things. So his mission, and he can implement his mission very soon rather than waiting the long journey. As I mentioned, adaptability and flexibility. It's a good chance in the workplace. For instance, if the learner, the workplace, at that time he subjected with myocardial infarction, and he did receive background about it. So the tutor and the facilitator and the student, all of them, they should have to adapt themselves at that time to provide basic learning and to be flexible also in their assessment. So it is a chance to be adaptable and flexible. And as far as I know, if you recommend anybody to work in any place, and if you write he's adaptable to different situations, it will be credit for the learner. And we are going, as I mentioned, to shorten the journey. And then, because, I think I finished the time which has allotted for this part, I will stop here. But before I will, leave the microphone for Shazia, I have one question, Dr. Shazia and Dr. Ali. Do learning at workplace and apprenticeship and continuing professional learning represent synonymous concept, or do they differ in meaning an application. So we have two answers. They are synonymous or they are different terms. So I will leave you with the floor, and perhaps one of the attendees might give explanation for this. Meanwhile, I will take a breath.
Thank you so much, Dr. Kareem. So far, you have elaborated so nicely about workplace-based assessment, and this is really a thought-provoking question, which we can see. So yes, Dr. Mufarra, you have raised your hand if you have comment on that. Well, I can see that I'm unable. Yeah, you can.
Hello, could you hear me?
Yes, we can hear
First
you.
of all, Assalamu alaikum.
Walaikum assalam.
Thank you for Dr. Karim and for the organizer for this activity. I think it is a very good question, and I might have some explanation. And I'm going with the maybe with choose our option B, which is different terms. Really, just in conclusion, it's a lot of talk regarding that, but I think if we take apprenticeship, it's for the beginner and for the student, and teaching it's for the new entrance. Also, it is the purpose, maybe it's for training and to mastering specific profession or something like that. And the learner here, or he's searching for something, for certificate, for getting license, and it's happen inside the academia or inside the place. While if we are going to a workplace education, I think it's for the employee and the trainer, and they are looking for maybe gaining skill and competencies more than training or mastering specific profession. And also they are looking for improving job, or let's say performance or career, or and also I think it's sharing with the apprenticeship. It's in self training. That's me. I think with the coaching and monitoring or mentoring. I mean, uh, while CBD a little bit different. It's go with the employer with a specific goal. I think he has a specific goal more than the others, and they are looking for individual development more than training something or gaining skill, and looking for mastering. And most of the time it's talking outside the academia. It's outside the place more than inside. I think this is, and maybe
Great.
I don't know, but this is my
Great.
participation. Thank you.
Great.
Yeah, that's really great. We can see that another participant, they want to contribute. Yes, Ashwaq Ibrahim. Hi, Ashwaq.
Yes, can I participate
Yes,
in my
please.
opinion? Okay, thank you. My name is Ashwaq, one of the health profession education master degree student. I haven't completed my master degree yet. So this type of session is very important for me to enhance my knowledge. So thank you for all of you. Okay, about the answer, in my opinion, as a beginner, I think all of these three terms are toward the education and learning. But maybe the difference is between the timing. For example, workplace could be for everyone, undergraduate or postgraduate. The apprenticeships could be for the interns, or for doctors who are having their um, specialization training, or even the fellowship. Yeah, I mean, it's related to training mainly. Continual professional learning, I think it could be for the people who are continuing learning. For example, if you attend any session, you get CDV, and so. This is my opinion, not right or wrong.
Thank you very much. Great. Valid.
We can see that one of participant, yes, Bahauddin Hassan, please go ahead. if you want to comment.
Okay, first of all, thank you, Dr. Karim, for great presentation. My comment on the question which you delivered, we can have workplace as a big title for these two, apprenticeship and continuing professional learning. That to say they are workplace learning, but apprenticeship here we learn through model. That we have a model, then we learn through that model. And continued professional learning, this is a process which tutor, facilitator, and learner, they share learning in this part. So I put workplace as a big title for these two part of workplace learning, which is apprenticeship and
Sure.
continuing professional learning.
Sure. Very beautiful. Sure. Mhm.
Good. So, Prof, you can comment on that. And go ahead.
In fact, I can't comment because all of them, they provide very wide answer. And also, all of them, they made me to put a third option that workplace can accommodate both of them. Thank you
Good.
very much, all of you, for your interaction and your feedback. It was very great, very beautiful, and add also to me a lot. So we'll go now to the second part. I hope to spend 10 or 12 minutes on that. So part 2, workplace-based learning in some specification. When you decide to adopt workplace learning, there are certain processes you need to follow and to adhere meticulously to it. The first one is to design the workplace learning curriculum, which should be relevant, should be excellent, should address the need for workplace learning. This curriculum should provide students with basic knowledge in doctor-patient relationship, in history taking, in physical examination, in patient safety, infection control process, and professionalism. So before sending to the hospital, you need to provide, or the curriculum should contain all this information. The second thing, you need to develop very close, strong partnership. And I think during accreditation process also, accreditor always ask about this. Why? Because it's very important. You can't do the job alone. And as I mentioned earlier, now this is the era also of health system science. And health system science simply means what is the relationship of receiving learning at medical school and not connecting to the thing to after finishing your graduation. So development of partnership is very essential. And then what pattern of workplace learning you are going to adopt? Most of it, is it self-directed, directed self-learning? What's the type? You need to tell and to write it, very clearly. And then what type of assessment you are going to adopt? Mini CX, DOTS, DOBS, or what? Or portfolio, or Osler. You need to be very frank and straightforward on this. And as I mentioned earlier, you need to have a policy of training the hospital staff. The hospital staff are graduated and directed to deal with their patient, and they do this thing perfectly. If you need them to be a partner with you, you need to conduct a lot of workshop to prepare them to work as facilitator. And to provide structural feedback. And the feedback should be clearly mentioned and should be prompt, should be in time, should be many ways, of course. I think feedback, it needs a presentation one day because feedback should be structured, should be useful, it should be has a good impact on learning. And to ensuring integration with academic process. Being work in the hospital don't forget other academic purposes like researches. So all other academic activity should be incorporated in workplace. As well as mentoring and evaluation and being prepared for accreditation. You need to be aware of the NCAA, of WFME, all these standards. They should be very clear if you are going to work or to adopt workplace-based education. So at the end of the day, workplace education or learning offer numerous benefits for medical student and educator as well, as I mentioned in the earlier slide. The learning might be very formal, might be informal, might be unconscious. And one of the researchers, he stated that 80% of the learning occur informally. Also like this session and like this setting. So Dr. Ali, Dr. Shazia, please, this, process will help us, to improve ourselves and to update ourselves. So please keep this heritage. And sometimes you can get learning unconsciously. You do not prepare for it. Just by chance, you will get a patient with myasthenia gravis, and it is not, a time for you to learn, but unconsciously you get it there. So you need also to adhere or to accept that. And the learning might be in-house training or formal curriculum. Formal curriculum, everything is mentioned in the curriculum. And in-house training, you can do the work in the training, in the job or outside job. And the trainer might be the staff from the workplace or from other places also. How the student, they learn in the workplace? They can learn, sorry for that, through the specific learning objective, the course learning objective, the program learning objective. They can receive their learning through a published blueprint. Blueprint not only for assessment, also it will give reflection for learning. And some people, they resist publishing the blueprint. But in many studies, it was proved that blueprint will not add, a good result for student mark, but it will reflect accountability, transparency. So it might be, it is better to publish your blueprint. And the best way of learning at the workplace is the tutor, is the facilitator, the role model. They are the role model for their learner. So this is a very important part. And also the mentoring process will allow, through the feedback, will allow, a good result for planning the future of the student. Here, when I'm mentioning the mentoring, sometimes there's a confusion. Is it mentoring? Is it supervision? Is it coaching? But mentoring is everything. Mentoring contains the official thing, contains the personal development. Supervisor is supervisor. He adheres to certain regulation, to certain standard. Okay, he's a senior. But mentoring is the best, I think, description for, follow up the learner at the workplace. Learning from the patient is a very important part. And Amy, they have a guide for how to learn from the patient. And adherent to the authentic learning by attending the ER and the emergency work where the learning will be so authentic. Factor that contribute to the success of workplace-based learning is the sense of ownership. Let the teacher, the supervisor, the clinician in the hospital, the nurse, to feel this is their own. They are not a guest. They are not asked to do the work as a part-timer. Let them to feel that this is their job, this is their place. By, empower them in your different activity, in your planning, in curriculum design, in evaluation. This will add to the success. And we need, to disseminate the culture of workplace learning and to improve the attitude of the learner, of the society, and of the staff in the hospital to improve their attitude through workplace learning and the mutual relationship. By mutual relationship between different organizations and the institute, also the mutual relationship between the learner and the clinician. And this refer to the entrustable professional activity. We need to learn the student to do some activity. The learner to do some activity at the workplace. At the end of the day, we can assign them to do some jobs. So this is a mutual relationship. We can overcome all this problem. For instance, the time strain, to make it a habit. The learning during the workplace is also to meet the patient need, to disseminate, the culture of workplace assessment, to have a partnership with different organizations. And of course, the resistance for change is always there. We need to meet it with some flexibility. If your objectives are very clear, if you provide the opportunity for learning, you provide a good feedback, a good reflection, you will, as a step, you will add success. So the second part is over. Still, we have few time if you want to add, to comment. Meanwhile, again, I will take another please.
Any questions or queries by participants at this stage? Yes, please, Sati.
السلام عليكم.
وعليكم السلام.
ساتي عبد الرحيم ساتي، كيف أخباركم؟ دكتور كريم الدين وبقية الأطباء. كنت عايز أسأل يا كريم الدين، دكتور كريم الدين، ذكرت موضوع learning from the patient. يعني ما القصد من الحكاية دي، أو specifically what does that mean؟ يعني when the student or the learner see the patient and make clerking and see the signs and history and things like that, well, it is a different thing from that, how to learn from the patient in this context. شكرا جزيلا.
Another question, or I will go to answer?
You can first answer to this question, then we shall
Thank
take
you
next
very
one.
much, Professor Sati. I'm very happy to, to listen and to hear from you. Professor Sati is our professor. He's the one who, he's our role model, in fact. And this was a very valid question. The patient, first of all, we need to understand the doctor-patient relationship or the learner-patient relationship. If you respect the dignity of the patient, if you are professional with the patient, and this supported by the behaviorism theory, he will provide you a lot of information. He will allow you to examine him because he has a right to refuse and to reject. He will provide you with a good history. He will tell you about many things. Even I will tell you one thing, not only about learning from the patient himself might be assessor. In OSCE, for instance, you can ask the patient, what is your opinion about this candidate? And even at workplace, if you ask the patient about his opinion for this candidate or this learner, he will provide you with a lot of information. So the patient is not only a tool to stay there and to ask him and to answer us and just to take information from him. He should have to be considered as a part of the team. He's a stakeholder, and he's the main stakeholder. If he has this feeling, then we are going to have a success. And I think the answer might be more than that, but just for the sake of the time. And again, Prof. Sati, it is a very valid question. Thank you very much for this question.
Thank you so much, Dr. Karim, for answering
Thank you,
this.
Dr. Karim. Thank you very much.
Next question. Yes, Dr. Al-Hadi.
Thank you so much, Professor Karim for these amazing sessions. And of course, exploring workplace opportunities in medical education can be rewarding as the medical education combine healthcare expertise with educational skills to train the future medical professionals. This is very important for us. In this regard, and I want to ask Professor Karim, as he's an expert in both, can you share, Prof, examples of how medical educators have impacted the student outcomes or patient care? Have you any certain model of improvement project or such example or so? Also, I have a questions. How would you describe the work cultures and the team dynamic within the medical education area nowadays in the universities and in the field in general? And as this team dynamics is quite enough to produce such an impactful within the healthcare, and how you suggest to improve this collaboration between the healthcare providers and the medical education field. And we want to learn from you, and we want to listen your experience, long experience actually in this regard. And again, thank you so much, Professor Karim, as you are always inspiring us. And thank you so much for the organizing committee for teasing this important topics, and wonderful presenter, of course, Al-Hadi Miskin from University of Bisha. Thank you.
Thank you very much, Dr. Al-Hadi. And I know, Dr. Al-Hadi, this is your interest. I know that you have a lot of work, you have a lot of initiative. You have been graduated from Jazeera University, where you adopt workplace and rural medicine. I know you master this. And in fact, one of the objectives of this session is to gain, experience from you and from others. Anyway, what to recommend? I think the recommendation now is to enhance this session, to disseminate this knowledge, to disseminate this term even. If we are every time and then disseminate this knowledge, talk about this, it will be a fact. And I think in our experience here in Bisha, we are adopted in many aspects. We have many activities related to workplace. We have many premises we used to visit around the health system around here. Our students in different classes, they use the primary health care, they visit the primary care, the different. So I think our experience is in the way towards implementing in the future full work plan learning. So again, Dr. Al-Hadi, you and others who are interested and you have a lot of publication, you need to disseminate the culture. This is my recommendation, to disseminate it more, this culture.
Yeah. Moving to next question, I just want the question and answer should be short, looking at time, because we are left with 10 minutes only to end the session. Yes, Dr. Asad.
Assalamu alaikum, organizer.
Yeah.
Dr. Karim, thank you for your presentation, a nice presentation. I want to keep my questions too short. My question is the workplace learning and interprofessional education. What the relation between both? Can you elaborate in this and how to get benefit from this interprofessional education and workplace learning? Thank you for the opportunity.
Thank you very much, Dr. Razat. You raised very important question, I think. Workplace learning and interprofessional education. Interprofessional education is education carried by many people who have the same interest, the same objective, from different professions, from nurses side, from lab technician, from radiologist, from doctor. All of them, they can sit together and receive their learning anywhere as the classroom, and most of the time as the classroom. But the umbrella of workplace learning is more big and can accept interprofessional education at the workplace. So if workplace education, if interprofessional education is between different professions at any place, it will be very nice and sounded to be at the workplace learning.
Thank you. Yes, Dr. Hatim, quick question.
Yes, thank you so much, Dr. Karim, for this very valuable presentation. I actually have a comments and also a question. Definitely, the workplace, education is one of the basic things that because you prepare definitely the student to work in the real environment later. So my questions: how do you see the paradigm shift of medical education from an output to an outcome where the student definitely will focus in the workplace, especially in the different outcome. For example, nowadays here in Saudi Arabia, most of the health cluster and Ministry of Health branches, they focus on like population health management as a whole and giving accountable care organization. And definitely the student will know this term. Definitely he or she, when become a care provider, will focus on the mortality, morbidity, life expectancy, and this outcome and social accountability. So from your perspective, how do you think this can definitely be affected the workplace medical education? Thank you.
A quick answer, Dr.
Thank
Karim.
you
I'm
very
mindful
much,
about
Dr.
the time.
Hakim. I quite agree with your comment. And regarding your question, I can see these changes regarding the outcome, the final outcome will be achieved if we prepare ourselves well for workplace learning. Then the third part, we have 7 minutes left. I will just
sorry, Dr. Shahid, we shall take your question at the end of the session, so please bear with us. So yes, move ahead, Dr. Karim.
I will move ahead. The third part need 12 minutes, but I will just summarize into 3 minutes so that to maintain. So workplace assessment, I will leave this slide because no time. I will go to this table where I will compare different setting of workplace-based assessment and their utility. And I'm going to do some modification to allow you to check the last column. So workplace could be mini CX, could be TOPS, could be case-based discussion, could be multi-source feedback, and could be logbook, and could be OSLER. So most of these things, their purpose is formative. And in fact, most of the assessment of workplace is formative. However, the OSLER and the logbook might be used, and the multi-source feedback might be used for summative purposes. And the type of feedback is immediate in all of them. And their validity, their validity is high. However, the reliability, we have a big reliability in workplace learning. Why reliability is challenged in workplace learning? For many factors. Because a complicated patient, which have been examined by one student, we can't repeat the same exam again for another student. Number two, the assessor differences and the inter-rater reliability will affect the reliability as a whole, and the different hospital setting. So this is the main risk and the main challenges for reliability. Education impact is good for all of them. I hope if we have a time, this table is very important table, but time is very tight. So I will leave this slide which describes the multi-source feedback, 360 degree. I will go to this slide, which is very important. If we look to, Miller pyramids, reliability will increase if at the level of MCQ as the nose. It might be decreased when we arrive at the level of DOS. In contradistinction to the validity, which increase when you go up. Why validity is high when we are at DOS level? Because we are dealing with a true patient, with a true procedure, with authentic learning. So validity always increases when you go up. Don't worry if you have reliability low, because there are many buttons for learning, for assessment. If workplace learning doesn't work because it is less reliable, use MCQ, use short answer question, use OSCE. And you can overcome the decreased reliability by multiple assessment, might be 10, 12 assessment per year, multiple assessor, different assessment methodology, and multiple sampling. In fact, to conclude about the workplace assessment, it targets the object, which is good. It is a good tool for assessing the communication, and it will add to feedback much. And a good example is the Mini-CX, for instance. Advantage, it is learner-led, stress on skill, focus on high level of Miller, contextual, objectivity, reflection, and feedback. Without portfolio to document what is there, the workplace will be nothing. Possible disadvantage, limited reliability, lack of standardized criteria for different assessor, and time constraint. This slide, we refer to some recommendation by EMI. You can go to this. In conclusion, all of us, we need to support the opinion of workplace learning. Once again, I would like to convey my thanks and appreciation to the attendee and to you, Dr. Ali and Dr. Shazia, for your tolerance and for inviting me. And I hope to meet again in another presentation. I will leave the floor for you.
Thank you so much, Dr. Karim, for this such an insightful presentation, the way you started us explaining about workplace-based assessment and difference between assessment and learning, and then going through its evolution in medical education, and talked about few of the barriers, how we can implement it, and what are different frameworks to consider when we apply workplace-based assessment. So I can see there are a few hands raised. So yes, Dr. Ishfaq, if you want to comment something. Quick question, quick answer.
Thank you. I'm just asking where we can give the record on the slide if possible, because just we would like to hear it again, if you don't mind, please.
Yeah, we shall share recording of these sessions with all participants who registered with this session. So, and apart from that, if you go at Sesame website, there is a section webinar. If you click that, it will take you to our YouTube channel, in which all of these recordings, they are uploaded at YouTube channel. So just find us there at Sesame channel.
That's fine.
Yeah. Yes, Dr. Isa, quick question.
Professor Isa is muted.
Dr. Isa, if we can unmute him.
He's muted, yeah. Unmute him.
Dr. Ali, try to unmute him.
Okay.
Dr. Isa. Because by my end, I can't.
I think the problem is he's not turning his mic on. I give him
Dr. Isa,
permission.
can you try to turn on your mic?
Okay, we'll take the
Dr. Sati. Yeah, Prof. Sati, if you want to comment.
Hello.
Yes,
Hello.
please. Yes,
Hello.
Dr. Isa.
Yeah, I said that the in this workplace education, the Saudi patient is an important stakeholder.
We can't hear you. I think your voice is broken. We can't hear you. Prof. Sati, if you want to comment.
Yes, can you?
How do you think he in the process?
Sorry, Dr. Isa, can you please hold on at the moment, because we couldn't hear you. So let Dr. Sati move on with his question and comment, please.
Just I have no comment. Just a question or request from Dr. Karimuddin, if he can have another session about this subject, maybe after 2 weeks or 1 month, in the same line, we could be very happy to learn about that. If you could arrange for that. And thank you very much.
So if time and space allowed us, why not? Yes, thank you. Yes, Mangda, Dr. Majida, maybe. Yes, please.
Hello, yes, Assalamu alaikum.
Wa alaikum assalam.
Thank you, Dr. Karimuddin, for this nice presentation. My question regarding the categories of work-based learning. Adding the top of the pyramid is the formal category. Usually in practice, maybe formal is more suitable for the student. But for us in the general hospital, we are working mainly with the resident in the program. So time consuming is difficult. We feel that informal learning is more practical than formal. And also the residents have great benefit from this type of informal learning and workplace mainly. So what is your comment? Is it good practice or it has to be formal more than informal? Thank you.
Thank you very much, Dr. Maida. You brought very important point. The informal learning, we mentioned that it is 80% can contribute to learning. And I'm going to add the newly graduate student, I mean postgraduate student, if they receive a bit training, they are near to the student from many point aspects. So we enhance, in fact, informal learning are supported by many studies.
Yeah. Yes, Dr. Isa, go ahead and complete your question, please.
Yes, I'm asking about the position of the Saudi patient in particular, because they are important stakeholders in this process. How can we train them to accept and have good input into this process? Thank you.
Again, very important question and very genuine question and valid. And this is why we mentioned we need to change to disseminate the culture of workplace learning by, to improve our attitude towards the patient and also towards our colleague who insist, not to go to this modality of learning, workplace learning. So a huge effort needed to improve the attitude and culture of workplace learning among us as the trainer and facilitators, and to reflect this in our patient. And I'm sure, Prof. Isa, if you deal with your patient in a very professional way, you will get a lot of information from him. He will allow you to examine him, and he can help you also in assessing your candidate. So I think we need a great effort to improve this, this area.
Very quick question by Dr. Hiba. Dr. Hiba, if you want to talk.
Hello?
Yes, please.
Can you hear me? This is a very great session. I'm thanking the prof so much. I just hear from him something about the blueprinting, which we are using a lot in our teaching our students how to deal with their sessions in reading and in the examination. He just mentioned that blueprinting cannot improve the student, if I hear it well, the student performance, I think, but it is reflect the accountability. I didn't understand this very well. If you can just elaborate it more, Prof. And I thank you again for this great session.
Thank you very much, Dr. Hiba. I mentioned blueprint will help in assessment, and assessment drive learning, as I mentioned every time and then. I just reflect, the dialogue about publishing the blueprint to the student and not to publish it. And some authority, they consider publishing will not improve the result much, but it will make the thing more, reliable, will add to transparency of the process, but it will not add much to the grade of the student. I mean the publishing blueprint.
All right. Dr. Shahid, again, last question, and then we will end our session, please. Just quick question. I can see that you raised your hand since long time. Dr. Shahid, can you unmute.
Am I unmute now? Can you hear me now?
Yeah, we can hear you well. Quick question.
Beautiful.
Yes.
Thank you. Thank you. Thank you everyone for, for contribution. Just a quick question. How would you dissect this workplace learning and assessment from competency-based assessment and learning? Thank you.
If I understand the question well, learning, I hear very well the word learning and assessment in workplace learning. We can do the same. We can do, as if you remember earlier, I mentioned that the accreditors, they ask how you integrate your assessment and learning. And it was very difficult question to those who don't adopt the workplace learning. But in workplace learning, if you do mini CX or DOPS, at the same time, you teach the student how to do the thing, and you can evaluate him. And through your feedback, you will give another plan for further learning. And the answer might be extended more, but just for the sake of time.
I think that is the concise answer. Thank you so much. With this, we shall end with this webinar. Thank you, Dr. Karim, for your wonderful presentation and accepting our invite. And thank you all participants. Our next webinar will be on student well-being in medical education by Dr. Kamran Baloch, and that will be after a break of Ramadan. So happy Ramadan to all beforehand. We shall take a bit break during Ramadan time, and after that on 15th of April, we shall be back with our webinar series. And this is really very exciting topic. So do register with us. Thank you so much. And thank you so much, Dr. Karim and Dr. Ali and all participants. Have a great good night.
And thanks for you.
Thank you very much, and happy Ramadan to everybody. And we're looking forward to seeing you with our webinars of Saudi Society of Medical Educations. Thank you very much, Prof. Karim. And thank you very much, Prof. Dr. Shazia, and see you after Ramadan, inshallah. Thank you very much.
Thank
Goodbye,
you. Allah
everybody.
Hafiz.
Bye-bye.
Goodbye.
Goodbye. Thank you very much. Thank you, everybody. Thanks.